Hello and welcome to the City of Lubbock COVID-19 News Conference. I am Lacey Nobles and today's panelists are Director of Public Health, Catherine Wells, Public Health Authority, Dr. Ron Cook, Director of Pharmacy for United Supermarkets, Tim Purser, Mayor Pro Tem Steve Massengale, and Lubbock Mayor Dan Pope. So let's get started with Catherine Wells.
Thank you, Lacey. Just quickly give an update on where our COVID case numbers are and then talk some more about vaccines. Our new COVID case numbers still look good. We are averaging less than 20 cases a day. And as we continue to push to increase those vaccination rates, we really do need to work on keeping those numbers down. I do want to encourage anyone who's sick or has COVID symptoms, please stay home. If you go and seek medical care, please have them test you for COVID. We do want to make sure that we are accurately counting and tracking who has COVID in our community. Yesterday at our clinic, we hit a milestone at the Civic Center. Our staff administered the 100,000 dose at that clinic. And so far in Lubbock, we have over 150,000 doses administered to Lubbock County. These are people that came through the hub and also went to our pharmacies, our hospitals, and any other person or any other place that was offering vaccine. In addition to those vaccines that we've offered in Lubbock County, we see thousands of our residents in our surrounding counties also increasing the number of vaccines there. And all of our counties in the surrounding area have vaccination rates of at least 20%. This is fantastic. It's not just what happens in Lubbock City or Lubbock County. We want to make sure that our entire region is vaccinated to protect everyone. At the last press conference, I announced that the hub will be shutting down on May 1st, and the health department at that point will transition to focus on outreach to our community. At that time, we were anticipating that the amount of vaccine and the number of providers in the community would increase. And this is definitely the case. For example, last week, only 4 locations in Lubbock received vaccine. And then this week, that number jumped to 21 providers. And it is my understanding from conversations with the Department of State Health Services that those providers will continue to receive weekly allocations in addition to adding more vaccine providers in the community. Now is the time to go get vaccinated. Everybody 18 and up is welcome at the Civic Center for the Moderna. We have lots of providers with Pfizer in the community, and 16 and 17-year-olds are able to get that. And hopefully in the next coming weeks, we will see this vaccine open up to children as young as 12. And if that's the case over the summer, we're going to be working to get our youngsters vaccinated before school starts again in the fall. With that, I thank you all for being safe, and I'm going to pass it over to Dr. Cook.
Thank you, Catherine. That is good news that we've given out over 100,000 doses down at the Civic Center, 150,000 doses in our communities and surrounding Lubbock. This is fantastic news, and that is what's really pushed our numbers, our COVID numbers down, as well as our efforts with masking and social distancing. Those things really do help. There'll be a time soon that we won't have to wear masks all the time. But for now, let me encourage you to continue to do that. Keep our social distancing and masking when appropriate. I'll also say that, the weather is really nice outside. It is much better to be outside. If you're going to be in a large group, it is much better to be outside than it is inside. For example, go out to the baseball game this weekend and support the Red Raiders. That's an outdoor event. That's a perfect place to be if you're going to be in a crowd. So maybe I'll try to get out there as well too. There are variants here in Lubbock. Now remember, when you're infected with the virus and it starts replicating, and that's the part that makes you sick, that also leads to mutations. Anytime a virus replicates, it's not perfect and it turns into these mutations. Now, some of those mutations don't mean anything and they don't spread disease, but some of these mutations do. And some of those mutations, like the California variant, has been seen here in Lubbock, as well as the South African variant. In the region, we've also picked up the UK variant. Now, those are variants of concern as listed by the CDC. Those do cause or seem to be more infectious and cause more severe disease. So how do we prevent that from happening? We prevent that from happening by you going and getting your vaccine. Viruses can't replicate and can't mutate if you have your vaccine. So that's how we stop these mutations from occurring, is by stopping the replication, and you do that by getting your vaccine. Certainly, if you're sick, please go get tested so we can make sure that it is COVID. And let me give this information to the labs that are in our communities. If your facility is doing PCR testing, not the rapid testing, but the PCR testing, you can send samples to our lab out at Reese for genomic testing. If you have questions about that or need to know how to send samples out there, please call the health department and ask for our surveillance department. And we can teach you or get you the information on how to send those samples out to the lab. Talk a little bit about a couple of new studies that are out just this week. There's a new study that shows, it's an early study and a small study that shows those individuals, healthcare individuals that happen to be pregnant and chose to take the vaccine even though they were pregnant. It does show, they tested the cord blood on the infant after the infant was delivered, and it does show antibody presence in the cord blood on newborns. So that's fantastic news that moms who are pregnant, especially in their third trimester, early in their third trimester, that then deliver an infant, a newborn, that it offers protection, that vaccine offered protection, not only for the mom, but for the newborn baby. And this is wonderful news. If you have questions about whether or not you should get vaccinated and you're pregnant, please visit with your family medicine doctor or your obstetrician, whoever's doing your prenatal care. Visit with them and see if it's appropriate for you to become vaccinated. There was another article just published yesterday in the New England Journal of Medicine that talks about how long antibodies last. How long do we have protection after you get vaccine? So some of the vaccines have been out long enough, 6 months in some of the early studies, and it shows that antibody presence is still there after 6 months after the vaccine. That's as far as we can go right now. So it looks like 6 months after your vaccination is given, that you're still going to have enough antibody to help protect you. Now, we don't know how much longer than that. My suspicion is that we may need a booster shot. Late in the fall or early winter, we might need another booster shot to boost us back up, just like the flu. Most people are talking about a booster shot, and it will then include all those variants that are out there as well. Some other news, the CDC came out with new travel guidelines for people who are fully vaccinated. So at least 2 weeks after that second dose for Moderna and Pfizer, or 2 weeks after your first dose of the Johnson & Johnson vaccine, that if you're fully vaccinated, you can travel safely within the United States and not need to be tested before travel. You don't have to self-quarantine. I will say that all public transportation, including airlines, are requiring masking for you to get on the airplane. So you can still travel safely. You don't have to test prior, and you don't have to quarantine afterwards. Now, if you're sick, please get tested and don't get on that airplane, whether or not you're wearing a mask or not. And so that's good news. Like I said, masks are still required on airplanes, buses, and public transportation. And I'd still recommend 6 foot distancing, washing your hands a lot. That's all just good hygienic measures so that you don't get sick. Overall, we are in a much better place than what we were just a few weeks ago. And that's because you guys are doing a great job of getting your vaccine. Please, we have plenty of vaccine. Please get registered. Please come get your vaccine. We don't want you to be sick. Remember, vaccines don't prevent disease, only vaccines in your arm, vaccinations prevent those disease. And people often ask me, just the other day, I had another question, which one is the best? Which one would you get? I said, the one that you can get most readily available. If it's the Moderna, get the Moderna. If it's the Johnson & Johnson, get the Johnson & Johnson. We're in a much better place. Let's continue our trajectory. Come get your vaccine. We have plenty of vaccine available. Let me introduce to you the director of the United Pharmacies, Mr. Tim Purser. Thank you.
Thank you, Dr. Cook, for that introduction. And I just wanted to start off by saying thank you to the city and this task force, the members of this task force, for allowing us to continue to participate in a collaborative effort that really has just improved availability for vaccines to all members of our community. And so we're excited, as our teams and stores are excited, to continue to offer these vaccines to folks that want it. As Catherine mentioned earlier, the supply continues to increase in our community and throughout the state. With that increase in supply, it's more available than ever for folks in Lubbock and Lubbock County and state of Texas to come and get those vaccines. And I would just say that all of our locations, if folks are more comfortable going to a retail location where they traditionally have gotten other vaccines, or to their healthcare provider, now you have the opportunity to do that as more retail pharmacies continue to get supply. I know all of our locations in Lubbock continue to get additional supply of the vaccine, and so we're excited to continue the effort to vaccinate as many Lubbock residents as possible. The collaborative effort that we've done with the city has been very rewarding for our teams and for those that have participated in the collaborations with the city. The mobile clinics we've done have been very successful and have allowed access to the vaccine for more residents. And along those lines, we're excited to announce we were looking to expand our mobile clinic offering. And so we have done a collaboration with Texas Tech, with the Health Sciences Center and the United Supermarkets Arena. And tomorrow we'll have our first large clinic at the United Supermarkets Arena from 2 to 7. Those initial appointments of about 1,200 doses have already been booked. We are going to continue to do this clinic on a recurring basis every Thursday as demand continues to be there. So we encourage anyone who cannot get to a retail outlet, to the health department, to another provider. Obviously, this is another option for you to access the vaccine. We were really hoping to do a collaborative effort on campus to hopefully attract some of the student population, faculty, and then also make it available for the general public in Lubbock. So we're excited for that clinic. If you need more information on that clinic, you can always visit our website and look at our COVID vaccine links, and it'll give you a link to schedule, not only for that event, but to schedule any appointments that you might want at one of our retail outlets as well. So again, I just appreciate the opportunity for our teams to help the city of Lubbock and the community to expand access to the vaccine, and it really is exciting for our teams to do so. With that, I'd like to introduce Mayor Pro Tem Steve Massengale.
Thank you, Tim. Thanks so much for spending time with us this morning. And just know on behalf of the mayor and the city council, we're grateful for your partnership in our fight against COVID-19. I wanted to spend some time and give you an update this morning on the Lubbock Economic Recovery Task Force. I thought it was important to remind everybody it's been about a year. The task force was formed by the mayor. The members were appointed by the mayor, and it's chaired by Robert Taylor and myself. The prime directive was oversight of the recovery of the Lubbock economy. Once formed, we separated ourselves into 4 separate committees. We had one committee that was called the Get Lubbock Open Committee. We had a medical science committee. We had a communication committee, and we had an education committee. Not knowing what to expect, we leaned on 2 of our committees more than the other. We leaned on communications and our Get Lubbock Open committee, and you saw the results of those over the past year. I want to thank the 21 members of our recovery task force. They all answered the call of service. Sometimes that we didn't give them much notice, but They were a diverse group that represented many different facets of our community that were affected by the virus, and they've been nothing but great as we've continued to work through it. So as you know, Governor Abbott reopened Texas. I believe that was GA 34. The Recovery Task Force met following that announcement and gave direction to the Get Lubbock Open Committee to come up with a plan on whether or not we would have a new program guiding businesses or possibly stand down the Lubbock Safe program. And so that group came to the conclusion, and I'm announcing today that we are retiring the Lubbock Safe program. So you can take your sticker down, you can frame it, you can do whatever you want to with it. Everyone came to know those stickers very well. We had over 1,000 businesses participate in the Lubbock Safe program, and I'm proud of that. I'm proud for all of our businesses for participating. The Recovery Task Force developed a set of best practices for businesses to continue to rely on as we move through this. Those best practices are live on our website today. You can see them at mylubbock.us/LubbockSafe. So I want to make an important clarification. We are standing down the Lubbock Safe program, but we are not sunsetting our Recovery Task Force. We feel like it's still important to keep that group together, as there may be things we need them for. So to conclude, COVID still exists, and it's still a challenge for business owners. I would encourage business owners to look at our website and review the guidelines that the Recovery Task Force has established and use those as it best fits each of our unique businesses. Businesses still have the freedom to decide on how they want to keep themselves and their customers safe. It's just like no shirt, no shoes that we're all familiar with. And I would encourage everybody to respect each individual business's wish. If you see a sign on their door that says, please wear a mask, please wear a mask. Each business has its own unique needs, and I think those business owners know best on how to keep everybody safe. So that concludes my remarks for today. With that, I'm going to turn it over to Mayor Pope.
Thank you, Mayor Pro Tem. Good afternoon or good morning, everyone. It's good to be with you today. I'm thankful for Ms. Wells, Mr. Purser, and Dr. Cook, along with Mr. Massengale. I want to start today by sharing a little data, as is our practice. So I'm going to share my screen real quick. Okay, so our hospitalization rate remains in an enviable position, down at or about 2%. We're very thankful for that. Dr. Cook commented on how well we're doing, and I think this helps bear that out. This is our case count by age over the last 14 days. You've followed the numbers. We're in that range of 10 to 20 new cases a day for the most part. The distribution of the new cases is not a surprise. In fact, this chart looks very much like the charts we've seen for the last year. Many of the new cases are in our most active part of our population. Good news is they're the least impacted, not bulletproof, but the least impacted by COVID. And finally, vaccination doses administered. Here's the message on this. We need more blue on this chart. Blue are first doses. And it's critical that we keep our success when it comes to vaccinations. I'll talk more about that in a minute. Okay, I'm back. So first of all, I think a couple of my predecessors have talked about COVID still existing. I think it's important that I'm sorry. I'm told I'm having trouble with video here.
It should be fixed now.
Okay, cool. Thank you, Lacey. I want to just reiterate the fact that COVID does exist. We know how to protect ourselves. We remain empathetic for the families and the businesses that have been impacted by COVID-19 over the last year. We're doing all we can do to make our community safe and to get people back to work. You're going to see a little shift in the way we're getting vaccines to people. United Supermarkets has been a great partner, and we're so pleased that they're partnering with Texas Tech and Tech Athletics to do their clinic tomorrow, which I think is fully subscribed. They'll be doing it again next week. There's vaccine available in United Pharmacies around the community. Likely your pharmacy, if it's not one of those, that vaccine's available. 21 different primary care providers received vaccine doses this week. We're finally to the point where we can say the vaccine is readily available in our community. In fact, Friday night, before, during, and after the Texas Tech TCU baseball game, we will be operating a pop-up clinic outside the ballpark. You don't have to sign up. You don't have to bring any money. You just have to bring your arm, okay? We want to vaccinate you. We will start taking vaccine clinics to places where people are gathered. If you're planning a large event, if you're in a large employer, a church, and you would like to work with us to get vaccinations to your people or the folks that will be attending your event, please reach out to us. Now, Catherine talked about us crossing the 100,000 barrier in vaccines administered at the Civic Center yesterday. The Mayor Pro Tem and I will be celebrating that next Monday afternoon late by, I think we're going to get pies in our faces. There was a chance of a TikTok dance, and I'm much less intimidated by a pie in my face. So stand by for news on that. Catherine also mentioned that we're north of 150,000 doses of the vaccine in Lubbock County since we began in late December. Let me go a little deeper into that. 72.4% of our population over 65 has gotten at least one vaccination. 57% of our population over 65 is fully vaccinated. Now, why is that important? These are the most vulnerable parts of our population. We've been at this long enough to know it. It pleases me so much that we've had success getting 65-year-olds and older vaccinated. But there's work to be done. We cannot let up. Now, when you're fully vaccinated, you get your card, which verifies that you've been vaccinated. You know, this vaccination and getting vaccinated and travel are tightly connected. I believe that by the 4th of July, that we'll be actively, all of us will be actively traveling to see families, to go to the lake, to go to the beach, maybe to go to the mountains. But let's get vaccinated so we can do that safely. Finally, I think we'll look back over the last year and we'll talk about the politicization of this whole pandemic. But let's not make the mistake of letting politics get into the vaccination. This vaccine is safe and it's highly effective. More than 90% of the physicians who have been offered a vaccine have taken it in the United States. We're at the point now where all Lubbockites, Texans, Americans, all adults can get this vaccine. We need accurate information and genuine freedom to make a decision about getting vaccinated. If you're on the fence, if you're reluctant, please call your physician or call the health department and talk to our people. We'd like to give you the data you need to make a good decision. This is about saving lives. It's about freedom. It's about living like Texans, Lubbockites, and Americans. Please, if you've not been vaccinated, seriously consider taking advantage of the fact that it's readily available. That's all I have. Back to you, Lacey.
Thank you, Mayor, and thank you to our panelists. Now we will open it up for media questions, and today's media question order is Matthew Stell with KLBK, Bao Pham with the Daily Toreador, Olga Guerrero with El Editor, Laura Lawhead with KMAC, Karen McKay with KCBD, and Matt Dotre with the Lubbock Avalanche Journal. So let's get started with Matthew Stell.
Thanks so much, Lacey. My question is for Catherine Wells. Catherine, do you think you're starting to see a better turnout at the vaccine clinic because you guys are offering the Johnson & Johnson vaccine, or just people wanting to go ahead and get it done?
I think a little bit of both. A lot of interest, a lot of younger people coming out to get that single dose Johnson & Johnson. I think also people are hearing that, that Civic Center, the availability of the Civic Center clinic is, not going to be there that much longer. And it's a very simple way to get vaccinated. So I think we're seeing a rush of people wanting to come in. Last Thursday, we hit one of our biggest vaccination days ever with over 3,100 people vaccinated in 6 hours at that clinic.
Got it. And Councilman Massengill, quick question for you about the Lubbock Safe program. Businesses, like you said, they can retire those Lubbock Safe stickers. They can take them down if they want to. But I imagine there may be some who still may want to keep it up for a few months just to let people know, hey, we're still operating safely. And I imagine that's your message to them too.
Absolutely. Again, the business has the freedom to decide how they want to handle this. If they want to leave that sticker up, they want to have their own sign, they need to make their own decisions for what's best for their business.
Thank you.
Thanks, Matthew. Congratulations on your new job.
Thank you, sir.
Now we move on to Bao Pham with the Daily Toreador.
Right. Good morning, everyone. My first two questions is for Catherine. So I'm aware that city has picked up the first dose of Johnson & Johnson vaccine for the vaccine clinic. So with the first one-dose vaccine available at the health clinic, will citizens be allowed to choose what vaccine they can take?
We have both options available. If you come in, if you make an appointment, you can make an appointment for either Johnson & Johnson or Moderna. However, if you choose to do walk-up without an appointment, your only choice will be the Johnson & Johnson vaccine. And that's really because we have to make sure that we have staffing and a space to give you your second vaccine of Moderna if you get it this month.
Right. Okay. My second question. So you mentioned that there will be a plan in the future for children as young as 12 years old to be vaccinated. So with that being said, by that time, will we have like enough vaccines for everyone eligible who wants to take a dose?
Yes, we're seeing more and more vaccine available in Lubbock and throughout the United States. The production lines for vaccine are a lot is coming into the communities. And I was on a call this morning and they were talking about they're expecting Pfizer and Moderna to be taking data to the FDA to hopefully be able to start get approval for 12 and up. And once that happens, our pharmacies can vaccinate 12-year-olds, the health department can, doctors' offices. So we will be pushing those vaccination efforts throughout the summer.
Right. Okay. My final question. So there's a research by Tech recently that 2/3 of the US states saw reduction in COVID cases after 3 or 4 weeks with a mask mandate. So understand that Texas is no longer enacting a mandate on this matter, but with the new dangerous variants of the virus is emerging and we are still nowhere near herd immunity. So is there like anything that the city plans to encourage citizens to use masks?
Yeah, thanks, Bao. Thank you for the question. I think we're going to stay the course. We want people to take every measure possible to keep themselves, their family, and their neighbors safe. And we want you to get your vaccination. Texas and Florida sort of lead the country in the way we've responded to this. And I doubt that Texas is going to change. And I certainly don't think the leadership of our council sees any reason to go a different direction.
Thank you, and have a pleasant day.
Thank you.
Thank you, Val. This next question is from Olga Aguero with El Editor. She's unable to attend today, so she sent me her questions. Will Lubbock school students and college students be required to be fully vaccinated before going back to school in the fall?
Well, that's certainly not a question that this group has responsibility for. I've not heard anything that would lead me to believe that will be the case. I'll let Dr. Cook answer in a minute. The only place that I've seen where they're requiring vaccinations are some small colleges. Certainly our K-12 is not going to be requiring that as we aren't vaccinating a number of those, the vast majority of those students. Ron, how would you add to that?
Exactly. It's still a drug under emergency use authority. So it's hard legally, probably. I'm not an attorney, but hard legally to mandate a drug that's under experimental use. And so until it becomes approved by the FDA, which I think most of these will, until it's approved, then it very well could be mandated. There are a few vaccines that we do mandate to attend public school, but this probably will not be one of them this year unless it's approved by the FDA.
Okay. And are there big outdoor indoor events still needing to request permits from the city or county in order to keep the event? And what kind of changes are expected for events of this type?
I'll take that, Mayor. There is no more need for event organizers to seek approval from the city. That was I guess a direction from the governor from a prior order, and that's been reprieved. So there's no need for that at this point. I think people understand what they need to do at this point. We've had enough experience with the virus. We know how to conduct ourselves outside safely. I would also refer them back to the Recovery Task Force best practices that we posted on our website today.
Okay, and that's all from Olga. And she wanted to say thank you to the committee on all their efforts and for the city, and condolences go out to all the individuals that have passed away and their family members. So thank you, Olga, for sending your questions. Now we go to Laura Lawhead with KMAC.
Hello, everyone. Good morning. So my first question is, it's been a month now since Governor Abbott lifted the mask mandate and reopened businesses back up. So since then, what overall trends have you seen in our number of new cases here in Lubbock?
Catherine, you want to start on that? Maybe I can add on to it.
We've seen a little bump, but not a significant bump that a lot of people talked about. We're still staying under about 20 cases a day. Trends with cases, it's still scattered throughout the community. I mean, we see cases from, a couple from schools, a couple from businesses. There's still that community transmission that's occurring. And that's really why it's important that while we're working to improve vaccination rates, that we continue being mindful of those other public health practices.
Yeah, I think that's a good summary. I would say that we don't find anything remarkable about the number of new cases. It stayed in the range where we were prior, very, very much where we were prior to the governor's announcement. And we want people to get their vaccines. It's the safest way for us to continue to reopen.
Gotcha. Thank you. It's great news. And it came, Dr. Ron Cook, like you said, it came out recently that Moderna should last us 6 months, but we're not sure how long after that. So what do you foresee of the future of COVID vaccination clinics and our rollout here in town later this year and even next year when those 6 months are up for everyone?
Great question, Laura. As Catherine alluded to, our vaccine market is rapidly becoming more readily available. So the producers of the vaccine are pushing it out. The state's doing a good job now pushing it out to everybody. I think as we saw this week, more pharmacies are receiving it. And then all the other providers that have requested it for their own clinics will soon be able to start receiving it in their own clinic. So in another 4 months, it's going to be very readily available in everybody's clinic. And so as patients need it, we'll be able to give it to them.
Gotcha. Thank you so much. And on behalf of all the journalists here, I want to say thank you to Dr. Cook and Catherine Wells for always doing interviews with us, even at last minute. Thank y'all so much. Y'all are the MVPs and y'all deserve a raise. Thank y'all.
Thank you, Laura. Now we can go to Karen McKay with KCBD. Karen? I see that you're unmuted. Can you hear us? Okay, we'll come back to Karen in just a second. Now we go to Matt Dotre with the Lubbock Avalanche Journal.
Good morning, everyone. Mr. Purser, are you taking walk-ups at all your pharmacies?
Hey, Matt, thanks for the question. We're still using a scheduler at our pharmacies at this point. So there's still demand. So our stores would be opening up availability at each location, and a guest would be using the scheduler to book those appointments.
Okay. When do you think that's, I'm picturing United's when you're advertising the flu shots and there's all the signs out front and there's signs in the store. When do you think you're going to get to that point?
It's a good question, Matt. It's kind of hard to tell. Demand and supply are still they're still pretty equal. I would assume as the vaccines become more prevalent, which we're in that phase right now, that could happen sooner rather than later. Some of our locations, this was the first 2 weeks in a row where we had gotten vaccine at most locations, and so we're very just now in that moment where all locations have vaccines. I think it's ways down the road, but it could be sooner than I think.
Okay, very good. Thank you. And then Mayor Pope, I kind of wanted to ask you, you mentioned the politics and the misinformation surrounding the vaccines. I think there's some studies now that are showing white Republicans are most likely not to get the vaccine. Do you think that's true in Lubbock, and how do you think that can be addressed?
Well, I didn't talk about misinformation. I did talk about politics. I'm not going to get into the politics of this. I think what's most important for us to do is to lay the case out to all of our citizens. The vaccine is safe. It's highly effective. It's going to keep you out of the hospital. It's going to keep you from dying. I mean, I'm about as hard-headed as they come, Matt. You've known me for a long time. But if I lay it out like that, I think you can make a case that people should very seriously consider this. They get the freedom to choose. That's important. But more than 90% of the physicians that have been given the opportunity in our country to take the vaccine have taken it. It's just important that we continue talking about it, that we make the case. There's people that I love, people in my life that I care for, that are very concerned and reluctant and still are not vaccinated. And so we all know those people. It's not beating them over the head. I think it's having a logical conversation. They're not going to grow horns after they get the vaccine. And so, we're going to continue to advocate for that. And we'll do it right down the middle of the road, right where armadillos walk, Matt, in the middle of the road. Okay?
Very good. Thank you. Thank you all.
Thanks, Matt. Let's go back to Karen McKay with KCBD.
Now, can you hear me?
Yes, ma'am.
I was having a great conversation by myself over here. Sorry about that.
Sounds like me, Karen, talking to myself.
I thought about this Easter weekend with a lot of family coming into town. How do you feel about, since the vaccine is readily available here, when you have family that come from Dallas or even out of state, are they welcome to go to the clinics and get a vaccine, or is that ill-advised? Will they be turned away?
No, they're not going to be turned away. We want people to get the vaccine, Karen, and we're focused on Lubbockites and Lubbock County residents and West Texans first and foremost. But if you show up and there's vaccine available, nobody's going to turn you away based upon you living in a less desirable state. I'm sorry, did I say that? In another state?
Great. And also we've talked about this in previous weeks, but when you look at the city's dashboard, and it's so encouraging that the hospitalization rate is 2.79%, but then you see the dashboard says that we have a 13.8% positivity rate. Can you kind of update us on that? Explain what that means now. Is that because so few people are getting tested? What does that mean?
Well, I'll start and let Catherine finish. I think that 13, that may have been a one-day number. I know that over the weekend, we reported Friday, Saturday, Sunday, and Monday. So we reported 4 days, and we did over 700 tests, 704 tests, as I recall. And I think we reported a total of about 38 new cases. I can do the math in my head, and that tells me that the positivity rate is right around 5%. The last few times I've checked it, that's been very close to where it's been. Catherine, do you want to, I don't look at I look at our numbers. I really don't look at the state website every day, but Catherine, can you add to that?
Yeah, your description's very good, Mayor. I think there's also a positivity rate that looks at our overall positivity rate, which doesn't show, looks at it over the course of the pandemic, and it doesn't show what's happening daily. And we really need to look at that daily, weekly, rolling positivity rate, which is the 5.
Okay, and can I sneak in? Thank
Sure.
you, Catherine.
Sure.
Can I sneak in one more question for Dr. Cook about the J&J? One thing nobody's talking about is, does that one make you more sore or have more side effects afterwards? Or everybody wants a J&J because they just want to go one time. So can you clarify, is that better if you can get the J&J and be one and done?
One and done, like I said, just come get a vaccine. The J&J, it doesn't make you any more sore. It's efficacy, how effective it is about 66-67% compared to Moderna and Pfizer, which are closer to 90-95 after 2 doses. But the Johnson & Johnson's only 1 dose, so 66-67% effective. But the studies on the Johnson & Johnson also show that even at 67% efficacy, nobody that received it was hospitalized if they came down with COVID. So that's the good point. That's the key point when you take it home. Our whole goal, 1, is to keep you from getting sick, and then 2, if you were to get sick, and that can occur with the Pfizer and the Moderna, but they're 90-95%. But you're not sick enough to go to the hospital. So we're not bogging down, when so many people were sick early on, our hospitals were just overwhelmed. We didn't have enough ventilators. All the things that go along with that. So just get the vaccine. But I don't think it makes you any more sore. That's just your immune system responding and doing exactly what it's supposed to be doing, which means it's going to protect you that much better.
All right, thank you.
Thanks.
Thank you, Karen. Okay, this concludes our news conference. First, I want to say congratulations to our usual interpreter, Lynette, on the birth of her new granddaughter this morning, Tempest Naomi. So thank you all for joining us, and thank you to our interpreter and our panelists today. For all the latest information from the city of Lubbock, check our website, mylubbock.us, or go to our social media accounts. Hope you have a good week.